Good afternoon, and thank you for joining us. This is Brenda Groves. I will be facilitating that and just the back end discussion today. So Nadine is not here with us, but she should be joining us shortly. Good morning, everyone, and thank you for joining us today for our first project Firstline session. We still have about 3 more minutes until we're ready to go. But I do want to give you guys an opportunity to let you know that we will be managing chat. So if you have questions or comments throughout today's presentation, go ahead and put those in chat. Also, if you would like to put your name and organization in chat as well, that will help us to keep accurate record keeping. Thank you.
Brenda, when I logged in, oh, I am a host. Never mind. It automatically put me into host mode unless you did that for me.
No, the other thing I did notice, just for future reference, it also automatically starts recording.
Oh,
So
okay.
see up in your upper right, do you see that red dot?
Yep.
And it says already in progress. So that must be a new feature. And I almost stopped it. I didn't know
Yeah,
it
but
was
I don't
already
know
on.
what that'll do if it, yeah. We'll
Yeah,
just
so
have
I
to
left
tell
it
people
alone.
there's lead time in the
Okay.
recording.
Okay. Well, it is just at 11 a.m. So again, thank you for joining us today. My name is Brenda Groves. I'm one of the quality improvement advisors at KFNC. I will be facilitating some of the back end stuff today. So monitoring for attendance, answering any questions you have in chat. Feel free to turn your cameras on. We'd love to see you. At this time, I will pass to Miss Nadine and get us started. Nadine, you're muted.
There we go. Sorry, folks. I'm talking away and can't see the controls to unmute myself. But there you go. Technology is our friend, right? Welcome to, I'll start over again. Good morning. Happy Friday. Welcome to the first Project Firstline session for communal living settings being hosted here in Kansas. This is the first of 8 sessions that will occur on successive Fridays at 11 o'clock. Many of you have already registered for the other 7 sessions. So this is my reminder to those of you who have not registered that you do have to register for each of the sessions separately due to the limitations of the WebEx system. So please don't forget to do that. These sessions, as you just heard, are being recorded and will be placed on our KFMC website events page when available. And just a reminder that you do have to self-mute. I don't believe you're automatically muted when you join, so just double check and make sure that you are muted during the presentation itself. You're seeing my message there. So Let's go ahead and get started. Thank you for joining us today. As you can see on this slide, we are going to introduce Project Firstline, and we'll begin discussing the concept of infection control as it relates to our day-to-day work. Today's session will be more general in nature, but in future sessions, we'll get deeper into the details of infection control. Go slides. So this is just our agenda for today. We have some learning objectives. You'll be able to understand the difference between COVID-2 and COVID-19, or SARS-CoV-2 and COVID-19. Hopefully you'll be able to explain parts of viruses and 3 steps on how those viruses use the cells of living things to make more copies of themselves, and explain one reason why infection control actions focus on keeping respiratory droplets out of the air and away from other people. So as you watch today, please, let me back up a little bit. I do want to mention that we only have 20 minutes together. So I'd like to start with a question, and you can put your answer in chat. Since we're short here, why do you personally do infection control? What's the goal and what's the point? I do have a video that I'm going to show for you that kind of answers those questions. So let's go ahead and play that video. I do want to tell you before we start, I'm going to maximize the volume on my computer so that you can hear that presentation, but you will need to make sure that you turn up the volume on your computer as well so that you can hear it.
Hello, everyone. I'm Abby Carlson. I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And welcome to Project Firstline's new video blog. On this blog, we are going to be explaining some of the basic ideas behind
Nadine, we can hear it, but we're still seeing the slides.
And then how they work to protect you and your patients.
Sorry, I'm gonna unshare here and go back to sharing content again and see if that gets you where you need to be. Do you see the slides now?
Yes. Yes.
Okay.
Your coworkers and your community. To start off with a little bit about myself, up until a few months ago, I, like many of you, was working in a hospital. I was part of an infection control team, and I was also working as a doctor, caring for patients. And as you know, it's been almost a year now since the beginning of this pandemic. For those of us in healthcare, it has been a year filled with a lot of change and a lot of challenges. We've encountered situations that were seemingly impossible. They were new, they were stressful, and quite frankly, they were scary and traumatic. We're doing so many things differently now because of COVID-19, from screening patients and employees at the entrances to wearing masks all the time when we're at work. These changes can be overwhelming to all of us, and we may not always understand why we're doing certain things that we're doing or why those things matter for stopping the spread of the pandemic. Let's be honest, there are a lot of infection control recommendations for COVID-19. There is a lot to do, and it is really important that we do it right. We here at Project Firstline are here to help with that. We want you to understand not just what you're doing to control COVID-19, but really why you're doing it. That's because we believe that you can do your job best when you understand why you're doing what you're doing. So before we get into the why, it helps to first think about what we're trying to do with infection control. The ultimate goal of everything we do in infection control for any disease is to keep people from getting sick. In this case, to keep people from getting sick with COVID-19. Obviously, we don't want our patients to get sick when they come to see us for care, but it's equally as important that they don't make us sick as we're providing care. And just as importantly, we don't want to make our colleagues and coworkers sick as we work together. We want this to be a safe process for all. We're in healthcare because we want to help people. That job is more important now than ever. And we all recognize that there's some risk of infection in going to work during a pandemic. So the goal of CDC's infection control recommendations is to protect you and everyone in the healthcare facility from getting infected while you're making sure your patients have the essential care that they need. And our goal here at Project Firstline is to make sure that you have the infection control knowledge that you need and deserve to keep yourself, your patients, your colleagues, and your community safe. In our next video, we're going to be discussing SARS-CoV-2 and COVID-19, two terms that we hear a lot, but we don't always know what the difference is between the two of them. So we're going to go into that in our next video blog. Please be sure to follow us on Facebook and Twitter to get our updates, or check us out on the web at cdc.gov/Project Firstline. We'll see you all at the next episode.
Okay, so now we're going to see what happens when I'm not real sure, guys. I says I have 2 applications. That's a new message for me. They change these deals every time we turn around. So I'm going to go through a few hoops here to get back to the presentation. And
While Nadine's getting that prepared, just because, again, they have updated the platform. If you guys had any issues with hearing the video, if you would type those in chat, just give us some feedback on that for our next session, that would be great. And for those of you who have put in your name and emails, thank you. If you noticed, I put myself, Nadine, and our partner, the other Brenda, there's 2 of us. I put our emails in chat as well in case you guys want to follow up with us later.
so as we watch these were a couple questions I should have had up that maybe you would be thinking about. Did you learn something new from the video, or were you reminded of something important that especially resonates with you? Can you think of somebody that you know who would benefit from these concepts? And have you ever gotten questions from coworkers or patients and family members? Did this video give you any ideas of how you could share or explain concepts with other people? So that was the video slide. So I have a feeling I might have pulled up the wrong thing here. This is where Project Firstline has changed something, guys. So we're going to skip this slide. So we don't have enough time. I must have pulled up the wrong slide set. So let's think about, now I'm really going to be screwed up, you guys. I'm sorry. So let's talk about that first video that we watched. Did you see any, was there something that you learned in that video? Sorry, I'm discombobbled now, everybody. Is there anything that you want to put in chat as far as what you learned from that conversation in the video, what it made you think of? Or you can speak up. You can unmute yourself and speak up as well. Brenda has to watch the chat because I can't see it in this mode. Can you think of anybody else in your organization, if you're at a leadership level watching this and not necessarily a frontline care worker? Can you think of anybody else in your organization that would benefit, or somebody that you know that would benefit from what they talked about in this video?
There is a comment in chat, and it states that I think so many of us haven't seen heavy losses, so the perspective of those who have is very impactful. So again, you guys are serving, not in that long-term care arena, the same folks each and every day. So you have seen how it's impacted in different ways. So
What kinds of questions do you guys get since you are in a different arena than some folks who are on the webinar or I myself have been in? I've always been in, well, I haven't always, but I've been in hospital and home health and clinic settings. And I know what kinds of questions I used to get. What kinds of questions come to you all from your residents or the loved ones in their lives? Or what kind of barriers have you run against with some of the things that you've had to do with your folks? Have you been asked questions that you couldn't answer?
we have a response in chat just talking about overall doubts, disbelief, and fear of the vaccination.
Okay.
I will note on fear of vaccination, again, we put our emails in there. We do have resources. They're directed to help you guys have those conversations with staff and address certain of their hesitancies and fears. So if you'd like to talk with us at a later time about that, please reach out to Nadine or I, and we'll get you the resources that you need.
Is there a specific reoccurring message that you're getting from those folks who are afraid of the vaccination?
We have a comment about side effects and just overall fears. And then we also have a comment about sharing the video once we're completed.
Okay.
Okay.
I know the first one may not be the greatest video to share since I'm a little bit disorganized today, but yeah, it can be shared. And I will show you, we'll make sure you know where you can go and access the videos. These videos are all housed on the CDC website, and so we can make sure that you know how to get to these videos.
Yeah, one of the big benefits of these videos is after, you know, we hope that you guys take these concepts out and are either, educating those that you're providing home health care to, or that you do any communal living settings, and just to also, educate your colleagues, your peers, and your families. Like I've seen in chat, folks talk about that's what infection control was to you, was to keep everyone in your life safe. And so using this material to help educate each person that you have a touch point with will help us get there. We have another comment that states most here don't believe it's been tested enough for the long-term effects on overall health.
Okay. That's a fair concern. However, we are getting, we are a year into people who have been vaccinated, and there's quite a pool of data out there now. I highly encourage people who get vaccinated to put their information into the V-Safe system. That is how we're tracking the efficacy and any side effects or issues that people have from the vaccine, and they're getting quite the pool of data. That's part of how they've gotten a lot of information on pregnant women in the vaccine safety, and we're getting quite a bit of data that way.
Hey, Nadine.
Yes.
One, I don't know if you know, but we can't see you, and I'm sure they all want to see you. But we have a question about if you could go into more detail about the Be Safe or the Be Safe program.
Yes, we can. Let me get through these slides. And like I said, these slides have changed a little bit, and there's some slides in here that I was not prepared to talk about. So I'm going to go through a little bit, and we can come back. This is talking about the viruses, which this was not in the first slide set that I looked at. So let's just talk about viruses in general. All viruses have two parts: genes that contain all the information needed to make more virus copies, and proteins that protect the genes and help spread the virus. Some viruses, SARS-CoV-2 is one of them, also have a third part, an envelope made of special fats that protect the genes and the proteins. And Viruses are able to use cells in living things, including people, to make copies of themselves. It's how viruses spread within a body and from person to person. When enough viruses have been able to get into our cells and make copies of themselves, the body recognizes that there's an infection and our immune system revs up to fight off that virus. It's the activity of our immune system fighting the virus that makes us feel sick. And I can say that that dovetails with the vaccine. Part of the deal with the vaccine is that's what you're feeling, is those cells preparing to fight things off and building that immunity in your system. So those of you who had your second Moderna shot and felt sick, this is exactly what was happening within your system. The other thing that we really need to talk about in the upcoming sessions, these are links on how to get to different things. I can navigate and show you those things though. So I'm going to actually deviate a little bit here and do that. So we'll have to figure out, can you see my web browser? No. Mm-hmm. Yes, you can?
Yes.
Okay. So when we want to look for the information that Project Firstline is, you go out to the CDC website and just put Project Firstline into the search, and you'll be able to pull up the Project Firstline training. These are, there's a lot of information out here about Firstline, but where you're going to focus your efforts is you're going to go to learn about infection control. And then this page gives you information, just general information on Project Firstline. And there's some posters that you can print if you want to do that to give more information. And you also can, when you get to watch a video, this is where we go to find the different videos. So we actually have a minute here. Let's go ahead and watch the SARS-CoV-2. What's the difference between SARS-CoV-2 and COVID-19?
Oops. I'm Abby Carlson. I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. Welcome back to Inside Infection Control, our new blog from Project Firstline. We are going to clear up today a difference that you see a lot, which is these two terms, SARS-CoV-2 and COVID-19, and understanding what those mean. We see these terms in many places in healthcare, and a lot of people have questions because it's not always completely clear what the relationship is between the two. So we're going to clarify that. SARS-CoV-2 is the name of the virus, the official scientific name of the germ that causes the disease, COVID-19. This can be really confusing, but it's actually not all that unusual. There are other times in medicine where a virus has one name and the disease that causes it is named something else. One example that you all might be more familiar with is chickenpox. Chickenpox, the disease, is that rash that you maybe got in childhood or maybe you got vaccinated against it. But the virus that causes chickenpox, the disease, is named varicella zoster virus. That's its official scientific name. So similarly, because SARS-CoV-2 is the official scientific name of the virus that causes COVID-19, when we talk about the virus and what it does in the body to make people sick, we use its official name. The places you'll probably see this most in healthcare is in testing and test results, where those results are often recorded by that official scientific name of SARS-CoV-2. You might also see it a little when people talk about the vaccine. On the other hand, COVID-19 stands for Coronavirus Disease 2019, COVID-2019. It's the illness that people come down with. The fever, the chills, the cough, the difficulty breathing, all those other symptoms that people have when they're infected with the virus. So COVID-19 is the disease, the symptoms that you come down with, and it's how we mostly talk about the pandemic. So to sum it up, we get infected with SARS-CoV-2, which makes us get sick with the disease COVID-19. But obviously, we don't want to get infected, and we don't want to get sick, and we don't want to spread it to others. And that is where infection control comes in. If you're wondering at this point, well, what's a virus? Come back for the next episode. We're going to talk more about that and then why that matters for infection control in healthcare. As always, don't hesitate to follow us on Facebook or Twitter and check out our website at cdc.gov/Project Firstline. We'll see you.
Okay, I'm gonna go ahead and show the next video, guys. If I can figure out how to get them to the point of being able to see it, we'll watch the What's a Virus video.
Hello, everyone. I'm Abby Carlson. I am an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And today we are going to talk about viruses. We talk about viruses a lot in healthcare, but people often have questions like, what exactly is a virus? What does it look like? How does it work? When you know a little bit about viruses, we can understand why certain things we do in infection control work to stop them from spreading and from making people sick. And even if you're already pretty familiar with viruses, you may need a way to explain it to other people when they ask you questions. So we're going to help with that. Let's talk a bit about the basics. Viruses are one of the many types of germs that make us sick, but we're talking specifically about viruses because the disease, COVID-19, is caused by SARS-CoV-2, a virus. It is a new virus in a family called coronaviruses. And that's why we talk about COVID-19 as coronavirus disease, because this new virus belongs to that family. Viruses aren't really a living thing like an animal is, and this is a big topic of debate, and we don't have time right now to talk about it on this video, but they are able to use living things like animals and people to make copies of themselves. And then they keep spreading from one living thing to another. Viruses actually only have a couple of parts. All viruses have genes, just like we have genes. And those genes contain all the information needed to make more virus copies. You can think of these genes like an instruction booklet or the blueprint of the virus. They're the thing that needs to be read in order to make more viruses. Viruses also have proteins. Again, just like we have proteins. Most of the proteins in a virus come together to create a shell. The technical name for this is a capsid. And that shell protects those blueprint genes from getting damaged. Some proteins stay inside the shell and they only come out when it's time to make more copies of the virus. Other proteins stick out from the shell, and those proteins are special because they help the virus get around the body and also from one person to another. Some viruses, not all, but SARS-CoV-2 is one of them. Some have another layer on the outside of that shell called an envelope. And this is just like the envelope in the mail that protects the letter inside of it. The envelope for the virus protects the genes inside of it. And it is made of some fats with some protein mixed in. It also, like the shell, has some proteins sticking out of it. And just the same as the shell, those proteins are used to help the virus get around the body and help it get from one person to another. So we'll talk about this fatty envelope again when we talk about hand hygiene and environmental cleaning. Because with cleaning, we destroy that envelope protecting the virus and prevent it from making more copies of itself, which prevents it from spreading. So now that we know what a virus is, we can talk a little bit more about how it travels between people and makes us sick, which can help us understand what we need to do in infection control to stop this from happening. We'll cover all of that in the next episode. So be sure to follow up with us on Facebook or Twitter. On Facebook, we have in the comments a picture of a virus that can help you follow along with each of these parts that we've described. And we'll be giving out new notifications of new episodes as they're released. So check us out there online at cdc.gov/Project Firstline, and we will see you with the next episode.
Okay. I'm not real sure why you guys can't see me. Now maybe you can. You all you had a question about vSafe, and if you go to cdc.gov and type in v-safe, you will get to the vSafe information. And you register, you can do it from your mobile phone, and then you get regular notifications from them about vSafe. So, what did you guys think about the viruses? Do you have any questions after reviewing that as far as what a virus is or what you would need to do differently with what you're doing in your organization? Do you have any questions that come up as you watch those videos? We have 2 minutes. What do you think? Does it make you just think I want it all to go away? I see somebody is looking at the beach. That's kind of where I want to be today. Whoever's screensaver that is, that's where I'd like to be today. Linda, I'm envious of your environment.
Nadine, this is Brenda.
Sure.
Did you want me to put in the chat box about vSafe? Sorry,
I did.
You did it. Okay, I see it now. Okay.
Well, I don't have anything else for you. Please stay tuned. I promise the next edition next Friday will be much more organized because I will check out my speaker notes as compared to the video this next time. The CDC has obviously been in the backgrounds tweaking things in the videos. So thank you for joining us. And next time we will join, we'll hear more about it. Thank you all. Don't forget, you have to register. Brenda, Davis, and Groves, if you want to hang on after everybody logs off, we can talk a little bit about some of those changes. Can we stop the recording?
I'm trying to figure, my record button went away.